For many years, Russia has had one of the highest mortality rates from cardiovascular disease in the world. This remains the case in 2017, even though rates have been falling since the mid-2000s. Today, there remains a substantial gap between Russia and most other industrialized countries. The very high rates of cardiovascular disease in Russia is one of the key reasons why life expectancy is low compared to many other countries with similar levels of national wealth. In 2015, it was 65 years for males, while in Norway it was 80 years, a difference of 15 years. For women, things are better, although female life expectancy is 77 years, while in Norway it is 84 years. Mortality rates are particularly high among working-age adults, who in all societies are the motors for prosperity for the whole population. This is why this situation constitutes one of the most serious threats to public health faced by any industrialized country today. It has a major and adverse effect on Russia's economic and social development. For further progress to be made in bridging the gap in life chances between Russia and other countries, cardiovascular disease needs to continue to fall from its still very high levels. In 2014, we launched a new scientific project to try and identify reasons for this high mortality, so as to find ways of making sure that the current decline continues. The international project on cardiovascular disease in Russia involves over 50 scientists in Russia, Norway, the UK, and Germany studying different aspects of the problem. The cross-sectional study is organized in a parallel way in two Russian cities, Arkhangelsk and Novosibirsk. In addition to that, the project includes healthcare studies being undertaken in 14 Russian regions, while many collaborative organizations of the project are based in Moscow and St. Petersburg. In Germany, the Max Planck Institute for Demographic Research is involved with the project component making the best use of existing data. Other key collaborators outside of Russia include the University of Tromsø, the Arctic University of Norway, and the Norwegian Institute of Public Health in Oslo. The group of international scientists working on the project is led by Professor David Leon of the London School of Hygiene and Tropical Medicine, which is one of the key collaborators on the project outside of Russia. This project has brought together numerous international researchers from a range of different disciplines. These disciplines include epidemiology, cardiology, microbiology, genetics, sociology, health economics, and public administration, among others. The study has a number of different parts. We are looking at whether mortality data for Russia is directly comparable with that from other countries. Although unlikely, this is to find out whether some of the difference between Russia and other places could be explained due to problems with the data. Another component is looking at the way in which cardiovascular disease in Russia is dealt with by the health sector. Are people with raised blood pressure identified by doctors and put on appropriate treatment, for example? We are studying how people with heart attacks are treated. Can everyone who has a heart attack have a reasonable chance of getting to a specialist centre for treatment? When they get to a specialist centre, do they get good treatment? And are they followed up adequately in the months and years after their heart attack? We are paying special attention to whether people in Russia compared to elsewhere have riskier lifestyles and behaviours than in other countries. Smoking is a very important cause of heart disease and stroke. We know that Russian men have until very recently smoked a lot, while Russian women have tended to smoke far less than in countries such as Norway and the UK. There are no really good National Health Survey data collected in Russia, and so we are bringing together all existing data on smoking and other things such as obesity to provide the best picture of the situation. Our biggest investment in terms of time and people is in two identical medical surveys we are running in Arkhangelsk in northwest Russia and in the Siberian city of Novosibirsk. In both cities, we have been inviting citizens to take part in a very detailed medical examination and to provide us with information about their lifestyle and health. By the end of the study, in 2018, we will have interviewed and examined over 5,000 men and women between the age of 35 and 69 years. From this, we are going to be able to assess in great detail the cardiovascular health of the people involved. Using advanced medical devices and methods of laboratory analysis, we will be comparing our participants in Russia with the participants of a sister study that was conducted in 2016 in the Arctic city of Tromsø. This will provide us with important new insights as to exactly what the nature of the problems are that lead to the big differences in mortality rates.
What we do in Arkhangelsk is that we perform a large cross-sectional study to look at the risk factors of cardiovascular diseases in a sample of a population of 2,500 participants. A sample of the same kind and the same study design is being applied in Novosibirsk. The study is being conducted in the same way in Novosibirsk, and the main partners we have in Novosibirsk is the Research Institute of Therapy and Prophylactic Medicine or Preventive Medicine. Another partner in Novosibirsk is Novosibirsk State Medical University. We are collaborating with Center for Physico-Chemical Medicine in Moscow with a laboratory named LITECH in Moscow. These are the two institutions where most of the samples will be analyzed. Besides the main sample taken from population, we have a sample of 250 patients of narcological department of Arkhangelsk Regional Psychiatric Hospital. This sample is needed because it's very important to look at the role of alcohol in development of cardiovascular diseases. The problem is that the sample from the general population normally does not include people with alcohol problems.
In a project like this, where data is collected in several geographically separate locations, it is crucial to make sure that procedures are carried out in the same way across all of these locations. To this end, detailed standard operating procedures and protocols were developed. These standard operating procedures and protocols specified exactly what should be done during field work for the project, to ensure that data was collected in a consistent manner in the different project locations. The development of the project's standard operating procedures and protocols was a collaborative process. For example, echocardiography examinations of the heart, also known as echo tests, constituted a particularly specialized part of the project. For these echo tests, specialists from Novosibirsk worked together with the team in Tromsø to design a specific protocol. The protocol was to be used in both this project and in a similar study that was taking part at the same time in Norway, known as the Tromsø 7 study. The protocol was used in both studies to ensure that the findings from the two studies would be directly comparable.
It took a lot of time and preparation to establish comfortable working conditions for specialists and to ensure convenience for patients. To this end, we have done a lot of organizational work. There was a long period of preparation involved, during which we chose examination rooms, renovated them, and conducted personal training. Before all of that, we selected employees to work on this project. All of our doctors and nurses in the project are certified and have received extensive training for the work being done. When selecting examination rooms, we tried to have the rooms located in accordance with the sequence of medical procedures for the project. This was done to make it as convenient as possible for patients and to avoid any long transitions. In this respect, I had to switch around some of the rooms that we used to help them better correspond with the sequence of medical procedures. The rooms were later decorated with the help of our designer. For this study in particular, we purchased a variety of necessary equipment. This equipment included ultrasound and electrocardiogrammer machines, a Vicorder device, and a unique actor heart device, which is used for continuous heart monitoring of the patient. All of our equipment undergoes regular maintenance. During the implementation of this project, a team of professionals has been working closely together, carrying out research of a very high standard.
In order to recruit participants for the study, the London team worked with various collaborative organizations to develop and implement a public information campaign.
Planning of the information campaign started in January 2015 with discussion of possible channels and instruments of informing citizens about the research study. Several focus groups were organized in Arkhangelsk with citizens to identify a hypothetical attitude and trust factors to participate in the research study. Several meetings were organized with local potential stakeholders like Archangel City Hall, advertising agencies, regional and city television companies. The next step was finding a simple name for the study. Узнай свое сердце, or Know Your Heart was chosen out of 25 suggested names because it causes trust, positive emotional perception. The information campaign was launched in November 2015 by the big press conference in Archangel City Hall with participation of the project organizers and the deputy mayor on social affairs. Banners of the study were placed on the billboards in the city and the big posters on the bus stops. Totally 5 city screens showed the video of the research study Know Your Heart. The promotion video was also prepared in 3 formats, 2 minutes, 20 seconds and 10 seconds, to be shown over the regional television. Posters were also printed out to be disseminated among municipal organizations, educational centers, kindergartens, schools, cultural centers and social institutions.
Teamwork and collaboration are crucial to the project, as is quality control, project management support, and negotiations with various organizations. In addition, the project aims to provide a forum for the training of researchers in Russia and elsewhere as to research methods. Finally, it should be noted that each and every one of the project team members made an invaluable contribution to the project. The results of the project's research will contribute to an improved understanding of the nature of cardiovascular disease in terms of Russia in particular, and also in a general, global sense. In addition, these results will provide evidence that should help to guide the formulation of improved strategies for the prevention and treatment of cardiovascular disease, in Russia as well as elsewhere.